Hello everyone, we have come up today with a very relevant topic, that is suicide. As today is a World Suicide Prevention Day, we have Dr. Pavana srinivas as psychiatrist to talk about it. Welcome ma'am.
Thank you.
So suicide is a very sensitive topic. So could you please make us understand about it ma'am?
Yeah, every year September 10th is observed as World Suicide Prevention Day. And every year there is a different theme. And theme for this year is creating hope through action. Suicide is a very serious problem which is not spoken much about. So as you already told, it's a Suicide Prevention Day. So we are looking upon suicide can be prevented.
Is there any data to understand the seriousness about it ma'am?
Yes, of course it is. See, worldwide almost about 8 lakh people die just because of suicide. And every 40 seconds there is one death. And almost about during pandemic, almost since 2019 to 2020, we might say, it has increased the double of it. Almost about 16.4% is per 1 lakh population is a suicide death, which we are noticing. And as this can be prevented, and I think we have to work on it.
Could you be able to tell us which age group is at risk now?
Yes. See, commonly there are age group between around 16 to around 39 is an average age group which we see suicidal death. But now there is an increase in the teenage suicidal deaths, which is around 15 to 19 year of an age group, which are youngsters and teenagers.
What you are thinking as a factor of it now?
See, suicide is in multiple factors. Our life is an event, maybe a good or a bad. Some people become very vulnerable to suicide when these kind of an uncertainty happens. So they would not be able to take it. And added on to it, if they are suffering from any mental health condition, like a depression or an anxiety, it's in contributing factors to it. And there are several risk factors to it. Like in previous, they would have had a suicidal attempts or a family history of suicide or being very aggressive. Say now the increase in the substance use, being an impulsivity, all these things have risk factors that increases the chances of them attempting suicide.
You have already told ma'am, nowadays teenagers is facing this issue. So as it is teenagers, do you have any message to our parents?
Yes. See, definitely. See, suicide, maybe most of the time it might be an impulsive or an underlying depressive symptoms or an anxiety. So to catch up these warning signs is very, very important for the parents. See, something like if the child is having an abnormal behavior, a change in their routine or change in their eating habit and sleeping habit or deterioration in the academic performance and increase in the substance use, or if you find out, yes, they are using substance or anything, then these are all the things which is alarming, and immediately they have to consult or professionals, or they have to the children.
So how our parents can prevent this?
Yes. Having a look on the warning signs and identifying it, and also talking about it. Usually we shy away talking about it and having a conversation. Usually we do not know how to converse with it, with the children, or it is usually stigmatizing. So that one thing we need to attribute on.
Is there any therapy for it now?
See, definitely. So more of a therapy or a mental health professional, meeting a mental health professional is very, very important. See, because we all know normal conversation, we are okay to talk as a friendly or anything, but to have a one-to-one conversation with the people who are actually contemplating suicide or they have having some other stressors, it is very important to have a professional help in that matter. So here, mental health professionals, what do they do actually, or a therapist, what do they do is, they identify what are the problems, why is a child or a person feeling suicidal, then they take on it, then they will assess them relevantly and they start on the treatment, or they start with the therapies, which are different.
Especially in our India, people does not like to talk about suicide in an open space. So how do we normalize this discussions?
Yes. See, usually what happens is we are not trained how to communicate with the children, or how we do not know how to communicate with this. We have a lot of myth regarding it. that if we speak or talk to a person who is having a suicidal ideation, we feel that we are implanting or seeding an idea to him. So this is very wrong. Whenever we talk to a person about a suicidal ideation, like asking him, are you feeling suicidal? Are you feeling okay about it? So how is your mood? How is that you are reacting? So what is that you want? See, this gives a hope for them to come out of it. See, the main theme of this year's suicidal prevention is creating hope through action. Creating hope in the sense itself is whenever you talk or you engage a person with this conversation, when you talk about this, it is creating a hope. A small change in our action or empathizing them, having an compassionate or being compassionate towards them. So it will definitely give them a hope and channelize them to express themselves.
Thank you so much, ma'am. That was very informative. Hope this will create an awareness about the suicide prevention. Thank you.
Thank you.